When patients come to you, first off, do you diagnose patients at all, or are you just going for the root causes to administer, perhaps giving that name? If they have Borrelia, it shows up somewhere, you could call it Lyme, but that's not how you'll treat it, just Borrelia. It's going to be co-infections, trauma, emotional, energetic disturbances. But how do you go about it? Because I know so many patients just want the diagnosis and say, I have this now, I feel better. No, you're not better. It's just a word.
For the reason that you just said, I do, because people
Mm,
think they feel better. But when
okay.
I do my explanation as to, but it isn't really your problem, it's
Yeah.
just the name of the problem. And they'll say, well, I have, I ever since my grandmother died, or ever since my partner died, or ever since I lost my dog, or I lost my job, or I said none of those cause anything. Mold doesn't cause disease, because
Mhm.
I could put 10 people in the same room, live in the same house full of black mold, and all 10 will not get sick. I
Sure.
said, why do they not all get sick? Because we have to individualize the treatment. Mold, Lyme, Borrelia, co-infections, mercury amalgams, trauma, emotional upset, lousy sleep are all triggers. The underlying cause, not to be facetious, is how well you chose your parents.
Mm,
Because I believe that problems start before conception
mm,
based on transgenerational energetics that are ultimately being passed down generation to generation to generation. I call it the terrain theory. It's sort of it's a word out of homeopathy where we look at miasm, temperament, and constitution. And as we look back, and so that's why I look at biological medicine. They say the start of it was with Aristotle, 350 BC or something like that.
yeah.
Hippocrates is 2400 BC. But you look at the styles of medicine that have come throughout, and Hippocrates basically was practicing biological medicine. They were looking at herbal medicines.
Right.
And Hippocrates even talked about temperaments. Shakespeare wrote about them in all his plays, but Hippocrates talked about them. And then, throughout the years, we have different physicians who sort of more emphasize them. Paracelsus in 1500 talked about the temperaments in different words and that type of thing. And Shakespeare, of course, writing his plays, used that because it was popular at the time. And we see all his characters in his plays, and every individual has a specific temperament. And there's lots of books written about it. You can find out what your own is. We all have a certain constitution. We have certain genes, but a very small percentage of our genes are different from person to person. I
True.
say to somebody, your pancreatic enzymes work the same as mine. Your heart works the same as mine, per se. But, I may be taller, a different skin color, a different hair color, different eye color. So we have a tiny portion, probably 1, 2% of genes that are different, per se. We only have 2,500 genes,
Right.
25,000, I mean, genes. And, when they did the Human Genome Project, started in 1988, they thought we'd have 150,000 because they thought a gene coded for proteins, and they were all proteins. And lo and
Hmm.
behold, they said, "Oh my God, we made a mistake." Then they realized that, oh, one gene codes multiple proteins. So that's when I believed with epigenetics in 2005, there is no such thing as an incurable disease. All diseases are now curable if you can set up the right proportions in the beginning when you start the intervention. Because even though there are, unfortunately with cancer, I could say pancreatic cancer, supposedly a 2% survival. Somebody survived it. Like, how did they survive a
Right.
condition that basically kills 98% of people in 5 years, per se? But we have a good friend who is a pancreatic, was given 2 months to live. He has no
Hmm.
sign of pancreatic cancer. What
Hmm.
was his main therapy? Prayer,
Yeah.
prayer, and his church. That's how he got healed. And lifestyle.
Doesn't that then go into the idea of the nocebo effect and what we're doing in our belief systems from even a conventional standpoint? Because most people believe they're doctors, right? That's just a
Correct.
known thing. By the time you're 7, it's usually ingrained in you. Your
Right.
mother says, listen to the doctor, little Bobby,
Right.
right? And so that
Right.
system is already there without us knowing. It's an
Right.
underlying belief system of the doctors, right? Listen to them. They know
Right.
best. They
Right.
understand your health. And then you go into the doctor, you're told you have a 2% chance to live with this. I mean, right there, your belief system has to kick in without you even knowing it. So how do
That
you
is correct.
feel we go about that? Because obviously in this day and age, if you have cancer, you're going to the oncologist. It's the only accepted route right now. You're going to be giving a percentile or, some survival rate. How do you start to, negate the nocebo effect if you're a patient given that?
Um, I like to think that it's about education. I'm a very optimistic person. I always feel the glass is half full and never half empty approach to things, and I basically explain that the present model of, if we use cancer, has no intention of getting rid of cancer. It has every intention of making it so we can't see it until we
Mm,
see it again,
hmm
per se. And if you go back to Warburg's work in the 1930s, interestingly, in Germany, of all places, as a Jew, working for Hitler, of all people, as a Jew, because apparently Hitler was paranoid of cancer. So in the work that Warburg was doing in cancer was basically showing that cancer cells had a very different electrical charge on their cell membrane. And we know now that this is definitely true. And if you look at a healthy cell, that has about a minus 50, minus 70 millivolt electrical charge per se. And you look at a cancer cell that has about a minus 15 millivolt. And when you have that minimum charge, you can't get healthy nutrients in. You can't get waste products out of inside of the cell where all the work goes for healing per se. And I read not too long ago that in about 20, just about 10 years ago, some oncologists started to say, maybe we should look at Warburg's work again. Maybe there is something to this electrical stuff per se. Maybe we do need to figure out, instead of just worrying about, are we doing chemo, radiation, surgery, or biologic medicine, which are basically the four approaches to cancer, how do we add electrical charge? And so you can go to European clinics where they talk about heat therapy, where they talk about adding electrons, which is, of course, what we can do here also, because now we have different types of instrumentation where we can do that type of thing. We know that cancer cells don't do well in a high oxygen environment. Why don't we provide people with hyperbaric oxygen
Yeah.
therapy, that instead of waiting until they have diabetes and, gangrene, and we're adding, so we have the technology, but once again, that's not medication. That's not about pharmaceuticals. That's about an action of a machine that you don't patent. You can't patent energy, and energy is here, per se. So I make people aware that there are additional approaches that people can utilize that are proven to be very effective, per se. And you don't like to say that. Unfortunately, I treat a lot of cancer patients, and unfortunately, many of them have passed away.
Mhm.
However, I have also had many positive letters from their survivors because their quality of life was there throughout the
Yes.
entire journey, per se. So some people are very open to it. Some people are not open to it. And it's like, it's not up to me to convince you that this is the approach. All I can share with you is what I understand about how the body heals itself. I know if you don't supply the proper nutrients, if you don't get rid of and move your lymphatic system on a regular basis, if you don't have a clean, I'll call it sewer system, your body's going to back up. We do a simple test, and your physical therapist or a gym can do a body composition analysis. It can tell you your body state of hydration. I would say 80% of the patients that I see are dehydrated. They say, well, I'm
Mhm.
never thirsty. Well, I can tell you your cells are, because you have this toxicity. And we can look at straight science and say, if 2/3 of your water is not inside your cell, you're going to be dehydrated.
Right.
And very, very few people have that unless you're 5 year a baby, who basically, I call them like 80% water. They're like a water balloon almost with some skin on, per se. But by the time we get into people in their 40s and 50s and 60s, when people typically come to see a physician with a chronic health problem, it's a very easy test to say you are chronically dehydrated, per se. And so it's not about, oh, I need to drink more water. It's like, when it rains here in Arizona, the water doesn't go anywhere. It's like we're like raining on concrete. I said you have to change the cell membrane electrical charge.
Mhm.
That's what's going to allow the water to get in. That's why we do electrical type therapies. That you can get some form of PMF device that you
Right.
can get online, or you can get them in our office are higher end professional models. But these are the types of things that people are starting to understand. Biohacker conferences now are offering all kinds of devices for adding things, which are great because people need it. They don't really, I find a lot of lay people don't understand it. They say, well, this must be good because I saw that it's at the biohacker conference.
Right.
Great, wonderful, doing it. Well, what are you doing it for? How do you know that that's what you need? I don't. I just think it's good. Well, if you had some guidance, I could tell you specifically the therapies which would be the most effective for you.